Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello and welcome to another episode of Physicians Keepers. I'm so excited to have you all here today. If you are listening on the podcast, Spotify, or you're watching on YouTube, thank you for tuning in. And I'm so excited about this conversation we're going to have today. I'm sure some of you have never heard anything to this, so this will be a revelation to you. So thank you. I have Dr. Mammoliti Mammoliti. Thank you so much for coming in, for volunteering to be a guest on Physicians Keepers. We appreciate you taking out the time.
Oh, I'm so glad to be here. So hopefully I can share some pearls that could be useful for everybody who's tuning in and, make their time worthwhile.
Yeah, absolutely. And for those of you wondering, she's not driving, she's parked.
I am parked.
So don't be afraid, don't be worried for her. Yes, we're being very safe, practicing being very safe here. So Dr. Mammoliti, she's a practicing Canadian psychiatrist, and she focuses on ADHD trauma, physician health, and eating disorders, as well as executive and boundary coaching. And so we are going to dive into a discussion, and I'm sure it's very unfamiliar to a lot of you, but she wrote an article on Kevin MD, and this was centered on administrative violence. So, for those hearing it for the first time, Dr. Mammoliti, what does administrative violence mean?
When people think about the experiences we experience as physicians, we often forget what the type of violence we experience. Most of us are familiar with physical violence, right, at the workplace. However, we all experience administrative violence one way or another and experience at some, point in the career. Administrative violence is when policies and processes meant to protect and to regulate are used to harm, target, and cause damage, right? And so administrative violence can range from, hospitals or colleagues using, administrative processes like complaints, board complaints, investigations to harm and target a physician. It is really important for us to have administrative processes to deal with any disciplinary issues, safety concerns, physician concerns, because we are, a profession that, we have to have the public trust. We have to be, self-regulating. We have to be held to utmost high standard. At the same time, very commonly, the same processes meant to keep the public safe and to make sure we're regulated well can be absolutely used to harm physicians in many different ways. So that is what administrative violence is when the administrative processes are used not as intended, but as a harmful way to target, control, punish physicians, or destroy their professional lives, financial ability, and ability to practice.
Oh, wow. Now, at what point did you realize that this weren't just kind of isolated incidents, but this was a broader pattern that was affecting physicians? Like, when did you come to that realization?
Well, I kind of have a bit of a cheat start here because, as you mentioned, I, do a lot of physician wellness and physician coaching and, physician health. I've been in practice now going into my 11th year. And even in residency, I was the type of person that people would come to for support, and I was involved in some committees. And then I continued being involved, right, with physician health, and physicians would come to me in distress and, with trauma symptoms and depressed and suicidal when they would be targeted with various administrative processes. And, I would have to support them in terms of psychiatric treatment and therapy and, kind of help support them and get the right resources. So I learned a lot about it through having all of these different physicians. And, I see physicians from every specialty, from family medicine to surgeons, hospital-based, private practice. So I've seen every aspect of it just by the sheer volume of physicians I've seen over 10 years and the type of problems I have seen. I have seen people who are chairs of the departments, researchers, private practice, and they come in distress. They come in with
Yeah.
trauma symptoms, with suicidal ideation, depressed,
Oh,
not
wow.
eating. So I've learned a lot from one, my patients. Two, I was also involved with medical leadership myself, so I've seen the extent of what can happen and what kind of processes. And because I have been, again, interested in this topic and kept up on, the cases in the news and processes in the news. So that is where my experience comes from, is, seeing it up front in the confidentiality of my office, my colleagues, my own experiences,
Yeah.
my own, leadership journey as well.
Oh, wow. Now, you did mention from your article that particularly foreign trained physicians or early career physicians are particularly vulnerable. Why is it? Is it just the ignorance of the system and where we just go in thinking that, everything's happy-go-lucky and the administration is supposed to have our backs and they're going to try to do everything possible to help us and not to hurt us?
Well, I think there's several reasons why. One, if you really think about standard medical teaching, whether it's in residency or medical school, we don't talk about how the processes can be used against you, because sometimes it's the school or the residency program or, your employer who's using it against you. They're not going to tell you about, hey, this is how I might use this against you, right?
Yeah,
And luckily, sometimes you might have mentors, you might have supervisors who might share their experience, right? Or sometimes now, especially, there'll be cases in the news. You might be aware there's a lot more lawsuits that physicians engage in, so there'll be a story in the news that people will follow and understand what might happen, right? But a lot of the times we don't talk about it. A lot of the times as well, when a physician is targeted by this, there's confidentiality involved, right? So there might be a very confidential process, so they're not going to share with peers. There's a lot of shame, and they might
yeah,
feel that they're the only one targeted, and because of the confidentiality, they might not be aware that other physicians have been targeted by the same individual institution. And, there might have been a pattern or saying that, people leave this facility often or leave this employer or they can't stay or whatnot. And people don't often think of what leads those people to leave, or why is it that you can't keep
yeah,
physicians. They often think, oh, maybe the other physician just couldn't cope, and they don't get to talk to the previous physician, right? So they might not find out the recurring theme. And so I think there's a lot of lack of education, lack of awareness. Part of it is that if you were to teach them that, that might be, going against what some of the policies are or
yeah,
ways of coping in the institution that's teaching you, right? And again, because of confidentiality, we don't know. There's no research and there's no statistics on how many
yeah,
physicians would have been targeted, because who is going to study this? Who is benefiting from the study? So very little, research, very little data, a lot of confidentiality, a lot of shame. Because again,
yeah,
when people are targeted, they feel ashamed, they feel isolated, especially if they have no supports. Which takes me to, the international medical graduates, because one, they are new to the processes. So they're more likely to be potentially targeted. There could be cultural differences that could be used to target them in these processes. An example would be tone of voice, right? Or directiveness, where somebody could be labeled as unprofessional or aggressive
yeah,
just because they have a different tone of voice or how they speak, because culturally there could be variability in speech, in the tone of voice, and something so non-specific could be targeted and used as a way to say you're unprofessional, very non-specific, and target that individual when that individual may not even realize that this is an issue, how to adjust, or the fact that it's not really a bad thing if you're speaking at a different tone of voice or rate of speech. That doesn't mean you're aggressive, it's just different.
yeah,
But that definitely could be used to target somebody, right? And again, international medical graduates tend to be on conditional visas. They usually have more conditions attached. They
yeah,
also have less supports, right? Their family might not be around, their spouse, their partner, whoever. So they're isolated. They don't know the system. They also often don't know their rights. They often don't know that they may need to consult a lawyer right away when things are starting to happen. So there's definitely lack of knowledge. There's a lot of this kind of dependent relationship where they might depend on visa conditions, work conditions, and definitely lack of supports, right?
Yeah.
And
Yeah.
also, a lot of IMGs might come from a culture where they might again internalize this, just like here, internalize it and see it as a personal failure. So again, there might be more shame. So they might not go to their supports, even if they have their spouse or family around. They might not disclose these difficulties because they might be really embarrassed, right? So the shame becomes a huge barrier, the isolation, the lack of power that international medical graduate might have in terms of finances, knowledge, knowing your rights is huge.
It is. It is. And you spoke some of the things that I could totally relate with a lot of
Mhm.
the things that you spoke around, with shame. If you followed my journey, you know that one of the reasons Physicians Keepers was started because I experienced bullying in training, right? And so one of the big things for me was the shame around
Mhm.
it, right? It's like, how does that look, right, for me to say as an adult, right, that I was bullied and I felt like not being able to stand up for myself or, and then I'm an IMG. I don't want to, cause any trouble. I'm just grateful to be in a program. Like, I'm just glad that I got a program and then you pretty much, this is your career. This is the
Mhm.
life. This is what's going to make money for you, right? And then you don't want to act like you're being troublesome by saying, hey, this doesn't feel right, or I shouldn't be treated this way because you're like, maybe I should just put my head down. Right. But then in terms of putting your head down, you get buried. Right. Because now it's like you're drowning because there's so much coming on you. You can't, no support system, no one to confide in. Right. And so you keep silent because you feel like you're alone in it. And also, you
Mhm.
also mentioned like the cultural barriers, and it brought me to one encounter I had and with one of my attending doctors. So I was in a patient room. It was one of those things where, as a resident, they come back with you and they listen to the plan, you talking to the patient and all that. And I was talking based on the way that, from a cultural standpoint, that's how we talk to patients. And then he calls me aside and he's like, you were talking to this patient like you were giving them orders. Like that's not how you do that. Your tone was supposed to be such a way that, hey, this is a partnership. Like you say, okay, I'm recommending that you take this drug because this is the best thing for you to do. It's still in your right to say, I don't want to take it. I will give you the pros and cons. It says I make suggestions and you make decisions, which is very different from kind of like where I was trained, where it's like, I just tell you what to do and you go ahead to do. It's like, no, so I can totally see how as an IMG, right, you then face all the struggles and these challenges because it's a whole different setup. And because you're not aware and you don't have education, you just keep silent. And that gets me to my next question that says, so what happens, when physicians speak about these unsafe practices? Like you talked about administrative retaliation, right? And that's one of the things we fear a lot. It's like I don't want any go back. I shouldn't finish my career here. I should want to just do what I came to do here. I don't want to be targeted. But what happens when physicians speak up about these unsafe practices?
Well, and I think that's a really great point because to be able to speak about these practices, one has to be in a position of safety. And safety meaning, one is safety from immigration standpoint of view, two, safety financially, that if you lose your
Yeah,
job, you're able to pay your bills while you're figuring
yeah,
things out, or that you're able to pay a lawyer to figure out your rights. Because, again, legal processes might take a while.
yeah,
So I think, sometimes we blame ourselves for not speaking up, and we forget that we were not in a position of power to actually be able to afford to speak up, because we
yeah,
can't, and I always tell people, when you talk about boundaries, when you talk about action, you need to stop and think, what can you afford? And unfortunately, you can't afford things sometimes because you really truly depend, like your livelihood depends on it, right? If you were,
yeah,
because often when somebody speaks up, oh, yeah, there is an object in overhead. I'm not even driving. But, when somebody speaks up, they might be threatened immediately to be taken off the call schedule in shifts, clinics, right? And that has happened. That has happened to people when they bring up even a minor issue or a minor disagreement, and all of a sudden they're taken out of clinic schedule. and they count on their paycheck to pay their bills, and so again, I think we always have to look at, are you in a position that you can afford to speak up, right? The other thing I always tell people is that, what is the cost and benefit at this point speaking up? Because obviously if there's immediate safety issues and liability issues, you might have to speak up right there and then,
Yeah.
versus something that you might, have some time to kind of accumulate evidence, or, seek legal advice, right? Because we do have to consider patient safety as, number one when we speak up.
Yeah.
And again, physical safety and things like that too, because and unfortunately physical violence does happen to physicians at a workplace from other physicians and co-workers. So we always have to think about physical safety. Patient safety is one of the biggest things, and then deciding what to do. And the reality is that a lot of these environments that kind of rely on administrative violence are like abusive families. Things are tolerated. The pattern of behavior of whoever engages in abuse is known. This is not new, because they've never known any different. This is what they tolerate, or they participate and benefit from that, right? So again, realistically, some workplaces participate from having a very toxic environment where they only expect people who are afraid, who are dependent, and they will prefer those people. They will select, candidates or residents or physicians who don't speak up, who are very passive, who are very anxious, because they're less likely to speak up, they're less likely to raise an issue, right? So they
Yeah.
will pre-select the people who don't speak up, and they will not hire people who are potentially local graduates with an independent license and no need for immigration status, because they're independent, they can speak up, they
Yeah.
can walk away. And those people will not understand why didn't I get hired, or why is this place relying mostly on IMGs, or mostly on kind of contracted workers, because they can easily control and less likely have difficulty with
Like
people
that.
speaking up, right? Because they can control, right, just by the structure of the system. So then, unfortunately, again, it becomes a place that kind of prefers people who are dependent on them, right? And then it's a lot harder to speak up and to break the pattern. And I always tell people that, listen, when there is this type of environment goes on, somebody benefits from enabling it. We might not clearly know who it is, whether it's because of financial structure, relationship, whatever it might be, but people benefit from things. Nobody continues a pattern if it doesn't benefit you, right?
Yeah.
And sometimes when we try to speak up, we don't realize who the players are, what the pattern benefits, or why it perpetuates. And sometimes it's not clear till like months later, or a year later, or 2 years later, right? And that's the thing. That's why it's so difficult. And so when we speak up, again, we really have to look at what's the cost and benefit. And sometimes the cost of speaking up is so big that individually we have to walk away. And we physicians don't know when to walk away, because again, we physicians are taught to continue pushing. If I work harder, and again, that's very equivalent like in an abusive relationship, right? An abusive relationship will think that if I work harder, if I look better, if I do more, maybe he or she will love me, accept me, or not abuse me. It's the same thing. What happens in these workplaces is that we think, if I pick up more shifts, if I do more call, if I do more research, if I'm more eager, and I was involved in one such workplace, and one of the people was like, well, why don't you just work harder? And I said, no, 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 no. Working harder is not going to change this. It's
Yeah.
just going to take up more of my energy, and it's going to just really annoy the person who was targeting me, because they see that I'm not struggling based on their
Yeah.
abuse. So, again, learning to walk away from things, learning to recognize the toxic workplace, learning to walk away, and learning to invest in legal advice is key things that we physicians are not taught.
Yeah.
Talking to a lawyer is worth its weight in gold, because that way we could recognize what our rights are. And often the lawyers involved in the local medical legal area might be aware of other issues. They might have been retained by other doctors. They might have been retained or involved in other issues with the same workplace. They might not tell you the details because of confidentiality,
Yeah.
but they might guide you, and they might say, listen, this is where it's going. You need to leave. You need to do this. You need to do this. And I would say, listen, because they may have more information than you realize. And again, lawyers are regulated professionals. Their advice has to be based on their legal knowledge, and, they have a duty to you when you pay them. So people often will talk to colleagues, or will talk, on all these social media groups. No, pay a lawyer, discuss what your rights are, discuss what your liability is, because again, there could be liability that you're not even aware by either
Yeah.
staying at the workplace or participating in this pattern, or your own liability to your license or board complaints. So I always tell people to put the money into legal advice that is individualized, with the lawyer having a duty to you, not the malpractice hospital lawyer, because their duties to the hospital, the
Yeah,
company, whatever.
absolutely.
Pay the money. It's the return on investment on legal advice is huge.
Oh, wow. And like you said, that's something that a lot of physicians do not do except when it's too late. Because like I said, I have encountered, just different people's stories. I mean, you hear all these stories on, social media, people coming to, doctor forums to ask for legal advice on certain things. And it's like, we are not lawyers, right? Do you want to seek, like, we can vent and do all we can on social media, but then that doesn't change anything. Right. You actually need to, if you do smell something, something fishy going on, it's always advisable that you go get some legal counsel and protect yourself because trust me, the hospital is already doing that. A lot of times by the time such things are revealed to individuals, then they discover that they had a file. Like pretty much they had a file, they had a case so that they were building on you and you were just moving around in ignorance not knowing that you needed to protect yourself.
And also because, again, if somebody's not familiar with the process, they don't even know the extent of the process or the steps of the process, right? Whereas a lawyer will tell you what the potential, process
Yeah,
is. They'll tell you this is the options between X, Y, and Z. This is what could happen. What are your options right now? Because again, as a lawyer, they can review your employment contract, they can review your, immigration paperwork. They will give you the advice about implications of X, Y, and Z versus social media forum that one has no legal training, doesn't have specifics of your case, doesn't understand your state laws, board expectations, and all those things that have liability. Because it's not just because again, people don't understand the extent of administrative violence, right? As I described in the article, it could range from board complaints, it could range from hospital investigation, it could range from losing your privileges and then you having to declare it forever in every other hospital application that you ever do. It could be, performance review. It could be board complaints. It could be lawsuits. It could be so much of a variety of things that most of us are not aware because one, we're never taught about it. People don't talk about it, but that's a real possibility. And you don't know where you stand. You don't know
yeah,
what protections you have, and you don't know what your options are. So talking to a lawyer right away is a big step.
yeah, yeah. Awesome. Now, you mentioned that you said that, administrative violence, it doesn't just affect you in the workplace, right? We're looking, it can go outside the boundaries. It can affect marriages, custody battles, parenting. Um, wh- why are physicians particularly vulnerable in these situations?
Well, and again, administrative violence does apply in terms of relationship breakups and whatnot. I have seen cases where, an ex-spouse will make board complaints or allegations, right? And again, we do have to take, the cases of domestic violence very seriously. It's not to say that, physicians, are not committing domestic violence. There could be assaults, physical, sexual assaults. We know that happens. At the same time, physicians also can be victims of domestic violence, right? And sometimes it becomes administrative violence, threatening, that if you don't give me this money or if you divorce me, I will report you to the board, make allegations, or call police and make all sorts of allegations, right? And then if there is, a police report of criminal charges, that could affect your license, ability to practice, all that other stuff. So with physicians, again, there is domestic violence. We don't talk enough about violence against physicians and what the abuse that physicians
Yeah,
experience, male, female physicians, because people think that because physicians of make high income that the violence is not likely. They often are not screened, and that's the problem because there are physicians who die at the hands of their ex-spouses and ex-partners. Like the violence is there. So even that, considering that, is really important that ex-partners can use administrative violence with various complaints. The other thing, again, sometimes physicians will, provide care to their partner or access their chart, which they're not supposed to. You're not supposed to in most states to provide care
yeah,
to anybody related or access anybody's health information, and yet they do, and that results in, privacy violation and complaints. So that's another reason too, is that, we're supposed to follow the rules, follow the rules. So to avoid any of this, issues in the future, you're
yeah,
you're supposed to do that. So I think, and the way that also impacts is that, look, when somebody's under stress at work, they don't feel, they come into work, they feel like they're constantly on edge, on eggshells, they're getting emails that, with complaints, allegations, whatever else. If they're feeling harassed, targeted, watched, right, they're more likely to be irritable, they're very stressed. Yeah, they're not going to be able to participate in their
Yeah,
relationship or family life the same way, right? They might be withdrawn, they can't contribute the same to parenting. There's also significant stress. Most physicians rely on their paycheck. I think there's a big myth of physicians being very wealthy. That's very few, with the generational changes of physicians who are, who entered, who are just regular people with student loans, not, intergenerational wealth. A lot of them have a lot of debt, a lot of crushing debt, reliance on their paycheck. So if there's any threat to their ability to work or make money, that is absolutely devastating to some physicians and their families. So that financial instability is huge. A threat of financial instability by the time you find another job, paying a lawyer, it's a huge crushing thing. And the shame, the isolation that people feel when they're targeted, whether it's in a department, facility, it really makes people present with trauma symptoms. People are not
yeah,
sleeping, people are not eating, they're on edge, they're hypervigilant, they're having nightmares, panic attacks. I've seen the whole range. And people get suicidal because they feel so trapped. And especially if it comes in an institution that they might have been trained or worked for a long time, and they feel the sense of betrayal because they might have been there 10 years, 5 years, and there's some kind of changes, new chair, new policies, or whatever it might be, new goals, whatever it might be. And all of a sudden there's an extra layer of betrayal because this is a place that they've known and felt home, and now it's a
yeah.
place that's targeting them.
Oh wow. Yeah, there's so many layers to this. And it's just definitely something that we said we probably not be able to finish in one conversation, and so we'll definitely be having, because I mean your article on Kevin MD is so extensive when it comes to administrative violence. And one of the things that you talked about as we round up, you talked about radical acceptance. So you're shifting from why me to what now, right? So how does that mindset protect physicians psychologically? Um, could you give us some insight into that?
Sure. And radical acceptance comes from dialectical behavioral therapy, right? And radical acceptance basically says, life is full of pain, life is disappointing. And what do I choose to do? It helps us to move from that helplessness to acceptance. And that's what we have to accept with medicine. Just like, I teach residents and medical students, listen, in medicine, there will be complications. There will be difficult cases. That is medicine. That is life,
Yeah,
right? You could do the best you can, and you will have complications. You will have disappointment. You will have, complaints from patients. You will have complaints from colleagues because this is life, right? It's all about accepting what we can't control and focusing on what can we do, right? So again, we can't control what other people might do. We can't control that if we have a colleague who is a bully or abusive, or if we have, somebody who decides to target us. We can't change that. We can't change what other people do. What we can change is learning about, again, coping skills, learning about, who our supports are, learning about, if I have this process, who's a lawyer in my area that is trusted to go to, right? This is what's going to happen. Obviously, and again, I all talk about to my physicians about risk management, right? Like manage your risk, right? Follow the expected guidelines, follow the expected board expectations in your behavior, treatment, things like that, right? Follow the policy. And despite following all of that, you still could be a target. You could be an excellent physician. You could have zero patient complaints, zero complications, and you could still be targeted by a colleague. And again, and sometimes it literally has nothing to do with you. Sometimes they just want your job, or they want more money, or they see you as a competition because they feel threatened for whatever reason, right? And so they're going to try and push you out. And many times, especially from colleagues, it's all about money, right? It might be the competition about the how the pay is broken down, whatever it is. And so we can't control what other people do. What we can do is be prepared, realize that you're not the only one. This happens every day in every department, in every hospital and facility. You're not alone. This happens all the time. We don't talk about it because of shame, confidentiality, and things like that. So it happens more people than not. Who are your supports? Who is the lawyer that you're going to talk to? what are you going to problem solve? And I really talk to people, listen, when things are starting to go iffy, you need to know when is the time to walk away, because like again, most physicians don't sit down and say this is the line that if it's crossed, that's when I'm resigning. Because
Yeah.
that's another thing, sometimes you're not able to resign because it's too late, because
Yeah.
investigation has started, or a complaint process has started, and the lawyer will advise you if you can or cannot resign, because most places you can't resign mid investigation, because then
Yeah.
if you do, you will have to forever report that to the board, you will have to report it to any other hospital. So again, this is why talking to the lawyer is really important about the language of anything and what this might mean to you, right? So if you're already feeling like you're being targeted, talk to a lawyer and figure out that you might need to make your next move before you don't have that option anymore.
Yeah, yeah. Oh, wow. And, just one of the things you mentioned, and I was pretty naive going into this space where I said, we're all physicians, we're all here to help each other, we're all here to hold each other's hands. We know it's such a tough profession. We're going to extend that courtesy, do no harm to patients, and we're going to extend it also to our fellow physicians. But you pretty much made it clear that don't go that's a naive mindset, right? Because there are physicians who are in this space that are not nice, that they're not looking out for their fellow physicians, like their personalities that are toxic, right? And they find themselves in this physician space, and we have to know that on time and don't going like me, just la la, just ignorant.
Mhm. And I don't want to use the word ignorant, it's very judgmental. I think it's more about that, we have this fallacy, we kind of assume that this person is similar because we all share an MD. And that's when I tell people that's exactly all we share is the MD next to our name, right? It's
Yes.
just like assuming that somebody from the same cultural background is like us. And that's a very common assumption when it's not true, because people are different, right? And I tell people all the time that, listen, there are MDs who kill people, right? There are
Yeah.
MDs who
Yeah.
kill their partners, who kill others, who kill their patients, right?
Yeah.
I don't have anything in common with those MDs for
Yeah.
many reasons, but they are MD, right? So we can't assume similarity just based on being a physician, right?
Yeah.
Because that's just a fallacy. It's a fallacy. And I think part of that is because we want to believe that we're collegial, we want to believe that we have the same values. We don't. We might have studied the same material, we might have passed the same exams, we might have an MD next to our name, but that's where the similarity might end.
Mm.
So that's where we have to really remind ourselves that people are different. People have different motivations for becoming a physician. People
Yeah.
have different motivations for doing what they do, and they might not be honest with you, right? And a lot of physicians are charming and quite manipulative, right? And
Mm.
charm is what we call bedside manner. Bedside manner is I'm able to talk to a complete stranger, put them at ease, to get a lot of personal information, a lot of health information, get them to trust me just because I said I'm an MD. And that's what we call bedside manner. Bedside manner is being kind, nice, calming to a stranger, so that we could get them to participate in patient doctor relationship when we just met them, whether it's an emergency department, on call, in our office, right? So a lot of physicians are really good at being charming. And charm is also part of what we call cluster B personality disorders, whether it's narcissistic, antisocial, psychopathic, right? So we can't diagnose our colleagues with personality disorders, but there's definitely colleagues with personality disorders. And if we can't diagnose them, we don't treat them. That's not what it is.
Yeah.
At the same time, we have to look at the patterns of behavior, and we have to look at what their behavior tells you, and what is showing, because what we're looking is pattern of behavior. It doesn't matter what people tell you. If they're hitting you while they're saying they're being kind, the reality. What
Yeah.
is the pattern of behavior, right? If the pattern of behavior is that they're criticizing you, belittling you, calling you names, excluding you, outright judging you, well, that's bullying, that's exclusion, that's being abusive, right?
Yeah.
So trust the pattern of behavior and decide what you want to do from there. We don't need the diagnosis. We can't diagnose people we work with, but we can make choices based on pattern of behavior. to inform us about, is this an individual who I feel comfortable with, right? And that's where the concept about emotional safety in the workplace comes in, psychological safety. Do you feel comfortable as an individual? Do you get consequences and punishment if you bring up a different opinion or your needs or, a concern? Or is that, reciprocated, validated? If you do make a mistake or if there is an issue, are they validating you? Are they helping you grow and learn? Because, we all have issues, right? We all need to
Yeah.
grow. But are they helping you grow, or are they targeting you and using that to punish you, get rid of you, or outright destroy you? Because
Yeah.
again, many times the biggest issue is when a mistake is used to destroy somebody or created to destroy somebody versus help them learn,
Yeah.
grow, and scaffold.
Yeah. Oh, wow. But so
Yeah.
much to unpack, Dr. Mammoliti. I know, like I said, I'm gonna put the link to your article in the show notes. If you're a physician and this is something that resonates with you, I would highly encourage you to go read this. Dr. Mammoliti is such a powerhouse of wisdom when it comes to everything regarding this. And so if someone is struggling and they're like, they're listening right now, they're feeling isolated and targeted system, and they think, okay, maybe I mean, I feel like I heard her. Like everything she said, I heard it. And I want to reach out to her. I want to talk to her. Like I want her to give me some direction. Because you said you're into the coaching space. Where did they reach out to you? How did they find you?
So, so remember, I'm only licensed in Canada. I'm only licensed in Ontario and Alberta. So I only see people where I'm licensed, and I don't do much, coaching outside of those provinces as well either. Just because
Mm,
I keep it more to that. I really would suggest if people are struggling to reach out to local resources, and local resources. I really encourage people to see a physician. Whether it's a psychiatrist or family doctor who does therapy, because I think fellow physicians understand the system the best and understand
yeah,
how things could be used and stuff like that. So and sometimes the best thing is to, if you don't know who to see, ask a fellow psychiatrist. But I've been on call multiple times. I worked in several hospitals. I've had people call me when I was on call and page and say, hey, listen, who would you recommend I see if I'm having a difficult day? And they
yeah,
will, suggest, right? There's also that volunteer line of physician support line. I'll try
yeah,
to dig it up in the US, where there was psychiatrist who was, voluntarily available to talk, and they might know who in the area might be able to help you. So I think, and also again, it's really important to be assessed to make sure that they're not like actively suicidal, have trauma and depression that might need medication and therapy versus, some coaching. Because, the issue with a lot of physicians is that they often seek help too late, right? Whether it's for legal advice or mental health. Because they're so afraid and to even admit that they're struggling. So
yeah,
I think sometimes they really need to be assessed to make sure they're not actively depressed, suicidal, or having trauma that needs medication versus coaching. Because
yeah,
sometimes they'll go to coaching and like they're not coachable, they need help. And
yeah,
and I've had physicians reach out to me before, even from the U.S., and I was like, this is you need to get more help locally, because it's a very very fragile situation and it has to be done within boundaries. But I definitely suggest, talking to lawyers, again, locally, medical legal lawyers who deal with this, because I think that will give a lot of actionable items and a lot of things that you could actually decide, and sometimes time sensitive, right? So I really
yeah,
do suggest talking to the lawyer, because some of these things are very time sensitive in terms of, legal timelines, options when you have an option. And you really do not want to miss any timelines, whether, like I said, filing complaints, quitting, taking action, documenting, meetings, whatever. There could be real time sensitivity. So that's what
yeah,
I would suggest. And again, I think my article, is meant to just help people to name some of the issues, because again, a lot of times we're struggling. We don't even know what we're struggling because we don't have the words for it.
yeah,
And like I said, in isolation, or especially if you're, internationally trained and you don't even realize how the system works. So I think my article is meant to just kind of like name some of these things. And I do list some of the, again, steps that people can take, but local resources I would suggest to consider. And definitely, if people are suicidal, which I have seen, seek immediate help. Like, your
yeah,
license in your medical practice is not worth your life. go to your emergency department, go see somebody locally, get help. Like medicine is just a job. Even if for some reason you're not able to practice medicine, again, I've met some people who, no longer able to practice medicine for one reason or another, including, cancer diagnosis
Yeah.
or other things, you could have a life. It might be a
Yeah.
different life that you didn't know exist because you worked in medicine for 20, 30 years, but you can have a life with the right supports to see that. But medicine is not all. Like there is a life outside of medicine, and we physicians have been so conditioned to not realize that.
We absolutely have. Well, thank you, Dr. Mammoliti. I mean, it's been just an amazing revelation talking to you today with your wealth of wisdom. And I do hope that any physician who's hearing this and found themselves in a situation that, just like you said, just naming it, knowing what it is, and knowing the right steps to take at the moment before it's too late, I do feel that this would be such a great resource for them. So we appreciate you for taking out the time today.
And you know what? I think I mentioned to you that I co-authored a book on boundaries with my colleague who's an occupational therapist. And again, it's not boundaries meant to, boundaries that we all think. Part of the book is we talk about the vulnerabilities, the abuse, the harassment, and recognizing, how do you recognize when you start working in a clinic or relationship? Like, how do you start
Yeah.
recognizing those red flags so you don't end up in this position, right? Because again, the key is we're not taught how to recognize things
Yeah.
before it's too late. So that's another link, I'll share with you. And again, it's meant to give people like the naming it to tame it so they actually have an idea what's going on, because again, it's based on all the experiences over 10 years I've seen with so many physicians.
Oh, wow. Oh, wow. Well, I would definitely be including those links in the show notes. So thank you. So if you're listening today and anything you heard, you know someone who's dealing with this, please like, share, subscribe, share with a physician that you know, based on everything you've heard, is experiencing administrative violence. Get the book, seek help. Like you said, you're more than a physician. As hard as it may be, if this career is something gets taken away from you, there's life outside of medicine. There really is. It may be a different life, but there is life outside of medicine. And if, yes, you want to say
And
something?
one last parting words is that literally, I have seen physicians, like when physicians died and then their patients were transferred, or the clinics, the moment somebody's gone, whether it's because of suicide or a medical issue, literally they're replaced the next day or within weeks. Somebody's going to replace it, right?
Yeah.
So again, just think of that you are so replaceable in medicine, but we can't replace you as somebody's daughter, son, brother, sister, mother, father, right? So again, medicine is just part of our life.
Yeah.
Do not ever let it own you to the extent where you're considering giving up your life because of whatever's happening in medicine or any of this administrative violence, because it feels so low, it feels so awful and so painful when you're being targeted. It's awful. Like when I've seen the patients, like I could feel their emotional pain, right? And because I have been on the receiving end of some of this too, it's awful, especially if you're isolated. I'm very lucky that I have a lot of supports, but people who don't, it's
Yeah.
awful. But
Yeah.
you are not replaceable in your personal life. You're totally replaceable in medicine. Medicine is not everything. You have a life. People need you outside of medicine, and not just need you, but again, you are
Value
somebody's,
you.
somebody, right? You're
Yeah.
somebody's
Yeah.
son, daughter, partner, friend, neighbor, parent, sister,
Yeah.
brother. You are somebody.
Yeah. Oh, wow. Well, thank you so much for your words of wisdom today, Dr. Mammoliti. And hopefully later on we can have a lot more conversations, because I know some people are like, I need to hear more. I need to hear more. But we got to get you off the side of the road. But thank you for taking that time. And if you are listening and you want to share a story, this is Physicians Keepers, what we do. We talk about physician stories. We hear valuable insights that were shared today. We learn how to support each other, how to be physicians keepers. And you've been an amazing physicians keeper today, Dr. Mammoliti. Thank you for this. And so send me a message, Dr. Remolo at gmail.com. I'll put all the link in the show notes. And let's have a conversation. Let's kind of talk about anything that, like I said, has affected you, impacted you in your physician journey, or would definitely benefit someone else. So join us at the next episode, and make sure you like, share, and subscribe. Thank you. Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.